Greetings to all participants of the summit and thanks to organizers for an opportunity to present our latest research. My name is Baranishyna and I am a radiologist in Oxford Medical Clinic in Kyiv. Let me introduce the results of our study. Analysis of the lung overall condition in smokers and volunteers that use alternative nicotine delivery products. This study was performed in 3 private clinics in Kyiv. It was a free lung screening in smokers. Research was made with 394 volunteers. Questionnaire includes chronic respiratory diseases and harmful work conditions. It was mentioned that screening was performed during COVID-19 pandemic. As a diagnostic method, low-dose CT lung with standard protocol was used as well as spirometry. Our spirometry calculates 32 parameters of external breathing using standard protocol. All volunteers was divided into 4 groups. First group was healthy volunteers, 100 people between 18 and 40 years. Second group was 170 people, smokers with smoking history for 8 to 10 years. Third group included 99 volunteers that had previous smoking experience less than 8 years and started to use tobacco heating system or an electronic cigarette for last 3 years. Fourth group consisted of 25 patients who had smoking history for 8-10 years, but quit smoking during the last year. Result of the CT lung showed the following changes in the lung. First group, stochastic finding engagement 25, other no changes. Second group, fibrotic nodules, chronic bronchitis, fibratelectasis, multiple bronchiectasis, bullous emphysema, calcification, encrusted pleura, hamartomas 158, other no changes. Third group, ground glass opacity 2, chronic bronchitis, fibratelectasis 36, other no changes. Fourth group, sporadic fibrosis nodules, chronic bronchitis, fibratelectasis 10, other no changes. Thus, no specific symptoms in lung were observed in the groups. What's interesting, comparing to day-to-day data, no signs on presence of malignant process or COVID-19 infections observed in all volunteers. Uses of alternative nicotine delivery system, electronic cigarettes, tobacco heating system has substantially better result of lung CT comparing to smokers. 2 patients who used tobacco heating system had placed with ground glass opacity observed on CT and non-pronounced lymphadenopathy. Both males switched to alternative products very recently, 2-3 months. Follow-up screening is recommended after 3 months. Regarding spirometry, you can see the data in the table. In patients with average 15 cigarettes per day and smokers index 186, high risk of smoking disease development. Respiratory function changes. Characterized as obstructive was observed 2 groups. It was related to the description of air flow in bronch. In patients who switched to tobacco heating system or electronic cigarettes, light restrictive obstructive changes of respiratory function was observed, third group. In patients who quit smoking history 8-10 years, light obstructive changes were observed. Taking into account all that was said before, and was admission harm reduction effect in people who switched to alternatives comparing to smokers. However, still the core recommendation stay to quiet all nicotine use. Thank you for attention.